My name is Alistair Fitzsimons, and I'm the Senior Manager for Community Social Care in South Eastern Health and Social Care Trust. The South Eastern Trust in-house domiciliary care team provide care to over 1,150 users each week, and we have a workforce of roughly 650 staff working across those geographical areas. Prior to CareLineLive, we were a paper-based service, so everything was done on manual sheets, and we were posting those out to the staff each week. The notice of work were posted out each week, but they would obviously change as the weeks went on. People going out of hospital, new referrals, so you could have been sending somebody a weekly rota maybe twice or three times in a week, plus all the recording sheets that they needed for the clients' homes. We have only got two bases, but we cover a big geographical area, so a lot of our communication with staff was done via post. Whenever we'd done a quick cost analysis prior to CareLineLive, the postage cost alone for our service was working out more expensive than the operating license for each individual to have CareLineLive. So the savings alone on the cost of a stamp covered what we needed to make the investment into the CareLineLive system. So as our service came out from COVID and we tried to rebuild the service, we identified that we had a gap in terms of communicating with our staff and having management oversight of the operational side of the service. So we looked across and we identified CareLineLive as one of the ways that we could reach out to our staff, improve communication, and also give us that management insight into how the service was functioning across both our staff, both sites, and how it was actually delivering and how we were using the resource of our staff in the most effective way that we could. We introduced it as a pilot initially within one of our teams, and then we took the results from that. We seen it was very positive feedback from the staff and from the service, and then we brought it across, and we now have our entire service working on CareLineLive, and we're able to give our team back that sort of work-life balance where we're no longer contacting them on their days off. We have good communication. We've improved our service to our service users, and we're much more efficient as a service in terms of being able to reduce staff travel time, increase time with our service users, and be more responsive to our hospitals who are looking for discharges and unmet need within our community for those that are most at risk and vulnerable. Yeah, each quarter we would manage our CareLineLive system. So we have a new team of staff that help us manage our CareLineLive system. So each quarter we would look at the CareLineLive operating system of our runs and rotas, making sure that we have logistically reduced travel time for all our staff, that we've put our service user visits into the most logical order geographically, and that we've identified where there's gaps in the service provision, that we can identify new patients, new service users to come on, and within the last quarter, so from October to December in 2023, that resulted in us finding 1,200 hours of care within our rotas each week to bring forward for new referrals. So within a 12-week period, we were able to bring forward 1,200 hours of capacity and release that back for new referrals into the service. Yeah, I'm not sure anybody's introduced technology to the health service and had plain sailing, so we don't feel too bad that we did have some difficulties, more regarding managing culture, managing staff expectations. Home care traditionally was something of a cottage industry. It was pen and paper, it was working informally with people, and CareLineLive allowed us to be more business focused, to be more sort of responsive, and to have better data. So there was some challenges for staff. Again, with our workforce being able to use the technology, we put support around that, and people came on board very quickly. Our care staff loved this from day one. We had a bit of a challenge with our office staff because it was a change to how we do our business and how they communicate out with the teams. And again, we brought this in as a pilot, so we did it step by step, phase by phase, bringing the teams on board. And by the time we got to, I think it was month 3 or month 4 of the implementation plan, we had very much gathered momentum, and the teams were actively looking forward to having this brought into their sector and brought in. So initially it was a bit of a challenge to get there, to get the funding, to get the approvals to do this type of investment within the home care service. Very quickly, when we got that on board, we were able to show the evidence coming back in terms of our improved governance, the way that we're allocating our staff into calls, releasing capacity, and being much more responsive. There was a number of factors. I mean, obviously we had our functionality map that we had to, certain things had to be done and certain had to be achievable by bringing in the technology. But a lot of it came down to the interaction with CareLineLive team themselves, their approach to us, how they were proactively trying to work with us to solve the problems. I don't think it was easy working with the Health and Social Care Trust. I think we had a lot of additional challenges that we brought forward in terms of our timelines and different measures that we needed and how we could procure the service. And nothing seemed to be an obstacle for the team at CareLineLive. They were very quick to come back, very responsive, and they really made it easy for us to bring the technology in. As a manager, the reporting functionality and the governance and the confidence when you're bringing forward now governance reports and having those conversations with staff teams regarding capacity, being able to address new referrals coming through that are a priority and finding that capacity, that certainly has been a key functionality piece. But I suppose more importantly for us has been the feedback from our families, from the care portal. That interaction that they can have, even if they're remote, if they're in a different town or city or sometimes in a different country, that they could be totally connected to the care that's been provided to their loved one. The feedback from the families has been 100% positive. The digitalisation project obviously is releasing capacity back through into the service to get those discharges of those vulnerable people home. We did then apply for, in South Eastern Trust, there's different awards, and the digitalisation project did win an award for being the most efficient, driving efficiencies within the service. And then the QI team also awarded the service a project award for digitalisation across the service and how that was brought in and the efficiencies and the improvements that it's bringing both to service users and to the staff within the service.